Hey everyone, excuse the bugs on the windshield and the shaky camera here, but I thought I'd film question, I think I'm on 27. I'm not certain because I'm in the car here finishing up a great week with my wife out here in the Southwest and taking you on my journey back to Flagstaff up Oak Creek Canyon, a very pretty drive. Just finished up a class today at Flagstaff Medical Center, and I had a great week visiting a lot of the sites here in Utah and Arizona. But I wanted to pass along the latest question for you. This should be question number 27. And I'm going to paraphrase a number of different questions that come in on a regular basis, asking me, Walt, in your class, do you cover dealing with Bell's palsy, or do you cover dealing with hemiparesis? And the quick answer is yes and no. All right. Let me go to the no first. There's very few things that I direct a certain technique at, meaning I don't teach a technique for Bell's palsy, a different one for dysphonia, a different one for globus, etc. I actually try and stay away from assigning diagnoses to a specific sequence or technique or anything like that, because I think that it hinders the therapist and their sense of curiosity. My whole point in the work that I do is to introduce a patient-centered approach where you listen to the patient through an interview, and the evaluation starts where the patient sends you. If Bell's palsy is affecting them, that's where I'm going to put my hands. I want to know the functional deficit. I want to know if I can replicate that feeling through a simple skin stretch, which affects the nervous system, affects the awareness, possibly affects the soft tissue, the fascia, and all those other things. But I try to stick away from assigning a certain diagnosis to a certain technique. So the answer about do I teach Bell's palsy in my class? Not in specifics, right? If you ask me about Bell's palsy, we will talk about it, but it's not something I routinely cover in every single seminar, nor a lot of other diagnoses, especially the thousands of different things that we can face in our clinics. But that also follows suit for, do I teach a specific muscle approach, like a lot of people teach manual circumlaryngeal work as a function of a dysfunction or tightness or muscle tension within a certain muscle belly. And while it's a lovely, simplistic way to look at problems, is the muscle by itself truly the problem? Did the muscle decide to get cranky and become problematic? Or is it a grander problem, a more central problem of brain or central nervous system in origin, and the muscle is just what's responding and reacting? Yeah, we need to know our anatomy, we need to define origin and insertions, because muscles are important, but I do think that there's a lot more to the dysfunction that we're facing with our patients than can be simply explained by one particular muscle or targeting a part of the body that you actually think you're selecting that muscle for intervention. So I guess I said a lot about what my class isn't about, but what it is about, it's a very patient-centered approach to manual care, one that targets the area of tightness that the patient reports the problem. What are we affecting? Well, like I said, we might be affecting the muscle or the fascia or the lymph or the central nervous system or the autonomic nervous system. I know I'm impacting the patient's brain and awareness. And I think that might even be the most plausible way to explain why the problem is there and why the effects are still there and what our impact with the therapeutic touch, the myofascial release style work that I teach, on what it might be impacting. So I hope that answers a few questions that come up. Feel free to continue to send the questions to me, even if you're repeating same questions. Do I treat Bell's palsy? In a way, I sort of do. Do I teach it? A little bit, yeah. Sorry for the graininess and everything that's going along with this video as I'm trying to keep the camera from falling off the stand here on this rocky road up Oak Creek, but I hope you enjoyed this little flavor of the Southwest like I did, and we'll see you next question.